How to care for a pregnant cat. Caring for a pregnant cat can be rewarding, but also challenging. How can you tell if your cat is expecting kittens? Here are some of the most common signs of feline pregnancy to look out for. Morning sickness. Yes, cats get morning sickness too. You may see vomiting and loss of appetite in the early stages of pregnancy. Enlarged or pink nipples. The nipples will become more prominent and enlarged around 2-3 weeks into the pregnancy as the body prepares for milk production. Weight gain. Your cat will steadily gain weight during pregnancy as the kittens grow, usually 1 to 2 pounds total. Make sure to monitor her diet and avoid overfeeding. Enlarged abdomen. In the second half of pregnancy, your cat's belly will visibly expand as the fetuses enlarge. Her sides may appear square-shaped versus rounded when viewed from above. Behavioral changes. Increased affection, restlessness, decreased activity, and nesting behaviors like kneading and seeking seclusion may indicate pregnancy. If you suspect your foster cat is expecting, schedule a vet visit for confirmation. Ultrasound is the most accurate way to diagnose feline pregnancy after 15 days from breeding. Preparing for the kittens. Once pregnancy is confirmed, you'll need to prepare for the big arrival. Here are some tips. Designate a birthing area. This should be a quiet, comfortable, and warm place away from other pets and household activities. A large box, closet, or bathroom works well. Cat-proof the space. Remove any potential hazards and restrict access to cables, small objects, toxic chemicals, or plants that could harm the kittens when they become mobile. Better safe than sorry. Stock up on supplies. Have kitten formula, bottles, heating pads, scales, towels, disinfectant, and other essentials ready to go in case of emergency. Your vet can provide specific recommendations. Learn warning signs. Educate yourself on signs of birthing complications like excessive straining or no labor after 24 hours of nesting. Always have your vet's emergency contact handy. Prepare a veterinary plan. Discuss costs, on-call vets, and other details with your clinic in case medical intervention is needed during labor and delivery. With some planning and preparation, you'll be ready to welcome the new additions when the big day arrives. Diet and nutrition. Providing excellent nutrition is crucial for developing healthy kittens. Follow these dietary guidelines for your expectant cat. High-quality food. Stick to a premium commercial cat food formulated for pregnancy growth. Look for high protein, at least 30%, with added calcium, vitamins, and omega fatty acids. Increase portions. Starting in week 3-4, gradually increase daily portions to 1.5x normal intake. Multiple small meals may help if she has morning sickness. She needs the extra calories. Unlimited access. Always provide unlimited access to fresh, clean drinking water. Dehydration risk increases during pregnancy. Supplements. Consult your vet about supplements like taurine for heart health or collagen for joint support if needed. Avoid oversupplementing. Treats. In moderation, small treats like boiled chicken or meat baby food can provide extra protein. But avoid junk food. Routine vet checks. Have your vet examine teeth, weight, and general health at regular intervals during pregnancy. Address any issues promptly. With proper nutrition, your foster cat can stay strong and better nurture her kittens in the womb. Don't hesitate to call your vet with any feeding questions or concerns. Litter box habits. As pregnancy progresses, some litter box adjustments may be needed. Bigger box. A larger box with lower sides or a cutout entrance can accommodate a growing belly. Easy access. Ensure the box is always in an easy-to-access spot. May not be able to climb or jump to a high location. Extra boxes. Place additional boxes around your home. This saves a long, uncomfortable waddle when she needs to go. Cleanliness. Scoop clumps 2-3x per day minimum. Change entire litter 2x weekly. Provide fresh, unscented litter only. She'll be extra sensitive to smells. Red flags. Monitor for signs of discomfort, difficulty, or bloody urine, which could indicate potentially serious urinary issues. Call the vet promptly if these arise. With diligent litter box care and access, you can make this necessity much more comfortable for your expecting cat. Don't be surprised if she avoids the box entirely as her due date approaches in favor of other spots. This is normal as she seeks an ideal birthing area. Grooming and hygiene. Grooming is important for comfort and health during pregnancy. Follow these tips. Brush regularly. Help remove shedding hair and distribute skin oils by gently brushing with a soft bristle brush. Going easy on mats and tangles. Bathing. Give occasional gentle baths if needed for cleanliness. Use small amounts of cat-safe soap and avoid her belly. Ensure she is fully dried. Nail trims. Clip nails carefully to avoid scratching kittens if she needs and nests. Grinding is safer than trimming. Dental care. Get her teeth professionally cleaned to avoid bacteria entering bloodstream and passing to kittens. Follow up with ongoing home care. Flea prevention. Use only veterinarian-approved topical flea control in low dosage. Flea infestations can lead to anemia. Personal space. Respect her privacy and allow her to seclude herself when nesting. Avoid overhandling or stressful grooming like hair clipping. With some common-sense grooming, you can keep your mama cat clean and comfortable without unnecessary stress. Always consult your vet before using any products or medications during pregnancy. Exercise and activity. While exercise is important, some adjustments should be made as pregnancy advances. Low-impact activity. Stick to short, gentle play and exercise sessions. Avoid stressful or high-exertion exercise. No roughness. Cats can get hurt more easily when pregnant. Keep other pets away that may play too roughly. Stop any roughhousing. Space for movement. Ensure she has room for self-directed exercise and movement, even if less active than normal. Support natural behaviors. Mental stimulation. Engage her mind with puzzle toys and training sessions. This supports neurological development in kittens. Monitor closely. Watch for signs of overexertion like panting or lameness, which could endanger pregnancy. When in doubt, let her rest. While an expectant cat doesn't need forced exercise routines, continuing appropriate activity can benefit both mother and kittens. Work closely with your vet to determine safe limits. Stress reduction and comfort pregnancy brings major physical and hormonal shifts. Help reduce stress for the health of mom and babies. Quiet space. Provide a quiet, dimly lit, cozy space away from noise and household chaos. This allows undisturbed rest. Routine. Stick to consistent schedules and routines for feeding, playtime, litter box cleaning. Cats relish predictability. Relaxation. Try relaxing techniques like feel-away diffusers, cat-safe aromatherapy, or calming treats. Always run these by your vet first. Massage. Gently pet and massage her in preferred spots, avoiding abdomen, to ease muscle tension and anxiousness. Patience and love. Allow extra patience for changes in temperament like moodiness or need for alone time. Give lots of affection. She needs your support. Vet monitoring. Discuss any concerns about stress levels or anxiety with your vet. They can provide tailored solutions to keep her zen. With plenty of rest, gentle care, and stress reduction, you'll have a happy mama throughout pregnancy and beyond. Signs of labor. As delivery day nears, look for these signs. Labor will soon commence. Nesting. She may seek seclusion, vocalize more, and refuse to settle in one spot. Frequent position changes trying to get comfy. Decreased appetite. Don't be alarmed if she skips meals or eats less the final days. Hard contractions make eating uncomfortable. Stay hydrated, though. Drop in body temp. Her temperature will lower 1-2 degrees Fahrenheit shortly before labor. Monitor with a thermometer if possible. Restlessness. She may seem anxious, pace, and overgroom. Reassure her. This is all normal pre-labor behavior. Discharge. A few days prior, you may see milky discharge from nipples and loosening hair around their base as mammary glands prep. Go ahead and alert your vet once these signs emerge. Better to be prepared even if she keeps you waiting another day or two. Once contractions intensify, birth is imminent. The stages of feline labor consists of 3 main stages. Stage 1. This initial stage can take 36 hours. You'll observe restlessness and nesting urges intensifying. Infrequent and mild contractions, 10-30 minutes apart. Changes in behavior like vocalizing and clinging to owners. Intermittent vomiting. Reassure her through this prolonged early phase. Avoid interrupting her quest for an ideal birthing spot. Stage 2. Active labor lasting 2-24 hours. Contractions are stronger, frequent, and noticeable, 5-60 seconds apart. Obvious straining and pushing. Rupture of the placental sac in kittens emerging. This is the most intense stage. Prepare supplies and notify your vet. Stage 3. Delivery of placentas over 1-8 hours. Delivery of placentas after each individual kitten. Bright red vaginal discharge, tapering to pink or brown tinged. Licking kittens to clear fluid from airways and sever umbilical cord. Doing well so far, mama. Clean up placentas as she eats them to avoid risk of spreading bacteria. Each birth experience is unique. Always have your vet's number handy for any concerns or emergencies during labor and delivery. The average litter is 4-5 kittens. Newborn kitten care, congratulations. The kittens have arrived. Caring for newborns requires attentive observation. Essentials. Bedding should be soft blankets or towels, changed out when soiled. Room temperature of 70-80 degrees. Rotate separated kittens on and off mom's nipples, each feeding. Gentle handling, supporting head and neck. Feeding. Nurse frequently, roughly every 1-2 hours. Supplement if mom cannot sufficiently nurse. Weigh daily and track weight gains. Watch for proper nursing position and latch hygiene. Stimulate genitals before/after nursing with damp cloth. Avoid submerging in water or bathing yet. Vet checks. Initial exam within 24 hours. Checking vitals and weight. Deworming and vaccines per vet's schedule. Spay-neuter once weaned, around 8-12 weeks old. With round-the-clock care and attention during these first vulnerable weeks, you're giving the kittens the absolute best start. Weaning kittens around 3-4 weeks old, kittens will begin naturally weaning from nursing. Gradual process. Mom will encourage independence. Kittens take interest in solid foods. Supplement feeding. Provide wet and dry kitten food increased at a careful pace. Teach litter habits. Place kittens in box after feeding so they associate. Praise successes. Socialization. Safely expose kittens to new sights, sounds, and handling by 8 weeks old. Full weaning. Kittens are typically fully weaned between 8-12 weeks as nutrition needs shift. Consult your vet on optimal supplemental feeding schedules, nutrition needs, and debuting solid foods. With patience, the weaning process will complete naturally. Congratulations, you did it. With proper preparation, diligent care, and attention, your foster cat and kittens made it through pregnancy and birth. Now the real fun begins. Watching the kittens grow and develop into healthy, friendly, and adoptable furballs ready to bring joy to new families. Bask in your foster parenting success. Recap of key pregnancy cat care tips. Prepare birthing area, supplies, and vet plan ahead of time. Feed high-quality nutrition and monitor weight. Provide ideal litter box setup throughout term. Groom gently and keep fleas away. Allow rest and provide a calm environment. Watch for labor signs as due date nears. Closely monitor mom and newborns. Get vet exam. Assist gradual weaning around 3-4 weeks old. Socialize kittens for adoption success. We hope this guide gives you confidence tackling cat pregnancy and fostering new life. Let us know if you have any other fostering questions.